Hello, my name is Kat Keane, Health Educator at Arthritis New South Wales, and welcome to the third episode of the Empowering You series. This Empowering You episode is called How to Help a Loved One in Pain, and it's essentially part two of the last Empowering You episode dealing with your diagnosis. So essentially, this episode is all about the perspective of the person who is looking after somebody who is in pain. And this person could be anyone. So it could be partner, boyfriend, girlfriend, husband, wife. This person could be guardian, caregiver, parent to a child who is in pain. This could perhaps potentially be a sibling, so looking after their brother or sister who is in pain. It could potentially even be a teacher looking after a child who is in pain, and just being able to identify certain things within this person. So let's have a look at what we're talking about. So we'll outline the session. We're going to have a look at pain, very briefly, acute versus chronic pain, how I am affected by their pain. So that's the person, the carer. What do I do to take care of myself, which is very important when you're looking after somebody else. Unpacking pain and where it comes from. So is the pain all in their heads? How to tell how your loved one is going. So how they're feeling, how they're traveling, what to ask doctors, and how to communicate with your loved one in pain. So firstly, and very briefly, what is pain? Well, it's characterized as either acute or chronic. Chronic pain is pain that usually persists beyond the time required for the healing of an injury or an illness. Some definitions set a specific period or time period. For example, pain which lasts longer than 3 or longer than 6 months can be classified as chronic pain. How is it different from acute pain? Well, it's what happens. So acute pain is what happens when you twist or roll your ankle, or when you burn your fingers, say, on a hot stove. So I think that we've all really probably experienced acute pain, and acute pain is important. It keeps us safe, and it's very much adaptive. However, chronic pain is a little bit different. So with acute pain, when you feel pain, you'll likely have some form of tissue damage. But with acute pain, pain can go on without tissue damage. So in some cases, and for some people, that doesn't really make any sense. They think if they've got pain that lasts longer than 3 or 6 months, there still must be something wrong with their tissues, when in fact the tissue might be actually fine and healed. And it's that point there that makes pain or chronic pain really a little difficult to understand and to deal with. So here's a great little illustration of the difference between acute pain and chronic pain. So helpful pain is the pain that you may receive, as I mentioned, if you, for example, rolled your ankle or touch a hot stove. This is acute pain. This is also what we will call nociceptive pain. So nociceptors are the little nerves in our body that detect danger, changes in tissues that aren't good. And they send that to our brain, and our brain makes us feel pain. And like I said, it's important. It can save our lives, and it's certainly adaptive. So we know not to put our hand on that stove again. However, we have then unhelpful pain, and this is also known as chronic and persistent pain or central neuropathic pain. So things can happen to our nervous system. So it can either be damaged or changes can occur, and these changes happen whereby they become a little oversensitive and hypervigilant to dangers. It could be touch, for example, or pressure. Where we wouldn't normally feel pain, we start to feel pain. So we're more sensitive. And also when we have conditions like arthritis, so osteoarthritis, rheumatic, autoimmune, such as rheumatoid arthritis, ankylosing spondylitis, psoriatic arthritis, juvenile idiopathic arthritis, to lupus, to Sjogren's syndrome, all of these have some element, well, especially the autoimmune rheumatic conditions have an element of acute pain where they'll get flares. So where the immune system will attack healthy tissue and you'll get an inflammatory response. And then there's an element, or there can be an element of chronic pain and persistent pain. And so that normally is changes within the nervous system from the continual disruption to the soft tissue. So how am I affected by their pain? So how are you affected as the carer of somebody who is in pain? So it can, or you may, develop a variety of mixed and negative feelings, which are all really, really normal. So for example, you could feel guilty at times because you can't make their pain go away. And sometimes you can't help them. You may feel angry or irritated, irritable and withdrawn. You may even resent them or resent having to take over the tasks that they previously performed either for themselves or for the family as a unit. You may feel depressed as there may be a withdrawal of affection from you. You may feel depressed. You may have financial problems, which causes a lot of stress. Because pain isn't and can't be seen from the outside, there's a lot of stress and perhaps even stigma around people with chronic pain. For example, let's just say, for example, parking in a disabled car spot. There's a lot of stress on you, the caretaker or the caregiver. You might get neighbors, just strangers, or even family and friends who may not necessarily understand, saying, oh, that person doesn't look disabled to me, or should she be taking that type of medication, or should you really be parking there? Those sorts of things. So they can become a huge problem and burden and pressure on you and the relationship you may have with your loved one who's in pain. You may even experience significant lifestyle changes. So you could actually be living on a reduced income now, or have to work harder to stay afloat financially. You may be giving up time where you had for yourself, things that you did to make you feel good, and giving up that time to take this loved one to medical appointments, for example. So you might find yourself doing a lot more of the household chores, for example, and the child rearing activities. You could be spending less time with friends and experience reduced social support. You could have financial hardship, as I mentioned. The loved one could be your partner in crime, and they can't work any longer or can't work as much. Therefore, that puts the pressure on you to look after everything and everybody else, but also work. And with a reduced income as well, can cause a lot of stress. And lastly, but certainly not limited to these four things, you may experience intrusions into your life from outside agencies. So these may be, for example, insurance companies may follow or film the family member. You also might be stressed by potential lawsuits, disability evaluations, or independent medical examinations, which can certainly make you may feel that you're losing a little bit of your privacy as well, and you may be time limited as well because of these things. What should you do then to take care of yourself? Well, it will really depend on what's going on, but certainly see a GP, a counsellor or psychologist to help cope a little better, and certainly a third party to help listen to you, for example. As often and as much as you can, try to maintain a healthy lifestyle. So that includes making good and smart dietary choices and being as physically active as you can. Try to find others to help with the care of your loved one. So reaching out to friends and family so that you can take a moment to yourself. Try not to personalize your loved one's behaviors. Now, that's really easy to say, but can be very difficult to do. But your loved one may be in a lot of pain and feeling really upset that day, and they may say things that may hurt you, but it's likely that they don't mean it to you personally. It's just they're not having a very good day. And if it's the case, then it might be best to step away and take some time out. Try to look for some support wherever you can find it. So you might find support in, of course, family and friends. At a school, there might be some school support, some school resources. You might find support through a church. You might find support through charities, for example. And lastly, learn as much as you can about your family member's condition and the available medical and other treatment options. And ensure that you discuss this with your loved one when he or she is ready to talk about them. And this ensures that you're just all on the same playing field and that you understand them perhaps a little bit better, and you showing that you care. Is it all in their heads? Saying, is it all in your head, or something similar to a person who is in pain may be interpreted as that you're just making it up, or I'm just making it up, which isn't the case. They're not making it up. The pain that they feel is real, and it's what they say it is. However, pain is a perception created by the brain, but it doesn't make it any less real. However, negative emotions or moods, depression, anxiety, a propensity for anger, for example, and even certain personality traits or types may make it a little more difficult to cope with pain, or make pain worse than perhaps it is. But we all experience pain differently. How should I respond to my loved one when he or she is in pain? Well, probably start with the last dot point, which should be the first dot point. Ask them, what would you like me to do? How can I better help you? Shall I go? Shall I stay? What can I do to help you? And this will obviously be very helpful and individualized and centric to this person you're dealing with. Also respectful as well, because what you give out to them is what they're wanting in return. So just ask them what they would like and how you should respond to someone when they're at their worst, for example. But also encourage them to be as active as possible, but of course not pushing them past their physical limits. Don't overdo on the sympathy or try to remove all obstacles and challenges from someone who is in pain. We still want to encourage them to be independent and encourage the development of autonomy and locus of control. But on the other hand, try not to punish the pain sufferer with blame and hostility. And while those feelings are really, really normal, and even that sort of resentful feeling towards them, if you're feeling that way, it's better to develop mechanisms in which you notice yourself feeling that way towards this person. And it's probably best at that point to take a break if you can. Go and have a cup of tea, go and do some reading, go for a walk, go for a drive, perhaps get outside and do some exercise. It's at that point there where that may be a sign where you need some rest yourself. How can you tell how he or she is going? How are they traveling? How are they feeling? Is something developing, like a mental health condition? What's going on? So you can look out for these kind of signs for an adult. So are there problems with memory or concentration? Are they exhibiting signs of poor sleep? So are they feeling rather fatigued and tired? Are they sleeping too much, wanting to sleep too often? Feelings of fatigue. Has their appetite changed? Are they eating more or less? And perhaps consequently, what about their weight? Has that increased or has it decreased? Are they having feelings of or showing signs of a depressed mood? Inability to feel happiness, not doing the things that usually made them happy, sad, anxious, irritated. Are they having trouble maintaining relationships? Is there loss of motivation or lack of interest? Are they self-medicating? So is there increased use of tobacco or alcohol, prescription drugs? Do they appear out of it or intoxicated? All these signs are signs that this person that has the pain is not coping well emotionally or physically. They're not coping well, so they're doing other things, they're behaving differently, they're self-medicating. It may be signs of depression, anxiety, insomnia, dependency on prescription drugs or use of illicit drugs, and suffering medication side effects. I think it's also good to say here that some of these signs in isolation, they don't necessarily mean that this person has depression or anxiety or is starting to use drugs to self-medicate. What would be a good idea would to be record these things, record these signs or these behaviors over a short period of time to see if they're increasing, to see if there's a pattern, and then you can address the behavior, the pattern, whatever it may be, if you feel there is concern. Now, this next page here is for those who look after a child up into the age of perhaps 16 or 18 even, who is in pain. So you could be a parent, a guardian, you could be a sibling, you could be a grandparent, anybody who looks after a child who is in pain, in this context from an arthritic condition. Now, some of these signs certainly overlap with the signs of adults, but I think it's a good idea to mention them because a few are slightly different. So certainly and significantly, what you may find is children, they hide or they mask their pain really, really well. And they won't show their pain or verbalize they're in pain. But when they do, they are hurting. And often they won't malinger. They won't fake their pain. If they're in pain, they genuinely are. And like most people who are in chronic pain, but especially children, they'll put up with it until it's really, really bad. So look out for avoidance or avoiding type behaviors, retreating or isolating, withdrawing. This can be at home or at school, in the playground, events, even with family members. Irritability, fatigue. A big one is really a sensitivity to the physical signs and symptoms of anxiety and nervousness. So often feeling unwell in the tummy or headaches. They're developing some sort of behavior or pattern, often like every day or every second day going to sick bay, for example, at school, and complaining of a sore tummy. Might be an indication that something's going on at home or they're feeling something, they're in a bit of pain. Poor sleep, and they may present with nightmares, scared of going to sleep or wanting to sleep with their parent, for example. Feeling of sad and crying and not enjoying the activities that really used to make them happy. Social problems are a big sign. So these are at schools, at events, or with friends and siblings, or even with family. So they can be feeling and displaying emotional or being emotionally dysregulated. So very difficult to control their emotions. So the outburst of anger or outbursts of emotion, like crying. They can be aggressive, disobedient, rule breaking, or again, withdrawing. Now, these may be signs that indicate this child is in pain, suffering from peer rejection, internalizing problems. They could be depressed, have anxiety, or in some cases PTSD. So these signs may tell you how that child is doing. I'd also like to point out that some of these are certainly normal for children who do not have juvenile idiopathic arthritis and similar conditions. But keeping a diary, just as we said in the previous slide, of the moods and the events is very, very helpful to establish or to look out for patterns in their moods and behaviours or triggers. Funnily enough, research certainly indicates that children with JIA in particular often have or display signs of emotional dysregulation, even aggressiveness, rule breaking, etc. at school. However, on the other hand, quite interestingly, these children at primary school with JIA, with pain and behaviours, also indicate how robust and resilient these children can be, especially when supported by highly cohesive family structures. So to me, that says that the moderator between between the pain and their behaviour is a cohesive family structure. So one that is safe, one that is supportive. So that's also something to maybe focus on as well. What else beside medication? So we all know that those people who are suffering a disease, a condition, but also those who are in experiencing a fair bit of pain, they can be on medication, but there are other things that can help them as well. So physical activity and healthy dietary choices both lead to a healthier lifestyle in general. Physiotherapy and other manual type therapies, even massage. Massage is a great modulator of pain. I always use the example of when you bump your elbow and you hit your funny bone. One of the things that you do is rub it, and you provide like a competing stimulus, and you don't feel the pain as much or as for long. And so that's what massage can do as well. So it's definitely not a fix, but it certainly can help manage. Perhaps try heat and other cold therapies. Assistive devices like braces or canes, telephone, headsets, orthotics. These can all help to reduce pain and that you could look into for your loved one. Adjustments so ergonomics essentially when it comes to seating arrangements. Other things that you could do, and you get a benefit out of this as well, by the way, is going and taking your loved one to yoga or Tai Chi or Pilates or whatever sort of they can do. Which is great physically, but also great mentally. There are psychological interventions like meditation. You might find there are heaps of meditation apps out there. Cognitive behavioral therapy. Remember, these are things that are good for you to know. These are good things are good for you to know to help your loved one. But these can certainly apply to you yourself, the person looking after somebody in pain. CBT, so cognitive behavioral therapy, might be a way that you deal with your anger or frustration or resentment at this person, or the fact that you have to pick up and do all the extra things in life. Guided imagery, progressive muscle relaxation, breathing techniques. So these are all fantastic. And lastly, for your loved one who's in pain, surgery in most cases should be the last resort. So conservative treatment should be approached and tried first, and then surgery. But what else helps people in pain? Maybe you could organize some fun for them. So things that maybe they used to like to do, and try and modify that. experiences and activities, things that you can do with friends, because often the social circle of the person who is in pain can reduce significantly, and that has a huge impact on their physical but also their mental health. You know, if somebody has a walking aid or is in a wheelchair even, or finds it just very difficult to get around on their own, will likely decline going out with friends or family or doing any sort of out events because they don't feel comfortable. But if you were to help organize it, you could do it so that your loved one feels comfortable doing something that they can do. So keep that in mind. When you go to the doctors, what are some good questions to ask so that you feel a little bit more empowered about how to help your loved one? So ask them what medications are prescribed, in particular the dosages and how often, especially if you're in charge of giving that, because then you may be the gatekeeper to these drugs and you might know the dosage or have to prepare the dosages and how often they have it, so a dependency perhaps isn't created. Ask what the medication does so you can be prepared. You know, does it cause drowsiness? It relieves pain, of course. It combats depression. It helps with sleep, so that if your loved one is having a hard time and they lose control of being able to take the medications themselves, then you can step in to do that. Give them what they need and when they need it. What are the possible side effects? And how will you know if your loved one is taking too much or too little? These are really important questions. Ask what the appropriate level activity is for your loved one, given their physical limitations. Again, also really good for you to know so that you can help prompt physical activity, when to say, but perhaps that's a little bit too much, or perhaps, no, we probably should do a little bit more. It's going to be good for you. And lastly, how to communicate with your family member or the person who you were looking after who is in pain. The biggest one is try to listen and really listen. It's one of the most helpful things that you can do for a person in pain. Pay attention to their nonverbal communication and how they're saying it. Good listeners are also able to drop their own preconceptions or assumptions. So listen without judgment. Just listen. That's all you need to do to show that you are genuinely interested and you have a curiosity about them because you care for them. It might be nice to repeat or summarize what is being said and how they are feeling so that they know that they've been acknowledged. So don't fake it. It can be really unpleasant to listen to someone talk about their pain. It certainly is, and it certainly can be. So basically, don't ask someone how they're feeling if you don't care or don't want to hear about it. And it's okay. Sometimes you just don't want to hear about it. So don't ask. Don't fake it. You can certainly tell. However, it's better if you're going to, because you think you should, at least give them, just a good 5 minutes. It's better to give them 5 minutes than to pretend. But the other thing is, we also don't want to deal with that social, perhaps, awkwardness that comes with it. So it does take a little bit of courage to ask sometimes how somebody is feeling. And that also, we don't have the answers. Sometimes we just want to fix it. You're likely not going to be able to fix it, but you can help, and you can definitely help by listening and genuinely meaning it. Understand that pain sufferers may be afraid to say how they are feeling. Many are very silent about their pain because of fear of ridicule or feeling of just what's the point? Or just thinking that if they don't talk about it, maybe it'll go away, or others underestimate their pain for similar reasons. So not expressing it or underreporting pain, these are coping mechanisms, and they can be misleading to us or the caregiver, and misleading to healthcare professionals as well. So when someone that you suspect is in pain and says that they feel fine, just let them know that you're actually really interested and wanting to help them, and that, but you understand if they don't want to talk about it, but saying that it's okay, you can tell me. Again, people might feel really odd, you can't tell that I'm in pain, I don't have a broken limb in a cast, you can't see that I've hurt myself, but I am in a lot of pain. And so there's a little bit of perhaps even some cognitive dissonance about that. You can't see that I'm in pain, but I'm in so much pain, it's so hard for you to understand. But perhaps just letting them know that, I'm really interested in how you're feeling. You can let me know. This is a safe space. Believe people when they say that they're in pain. Not often do people malinger and say it for the wrong reasons. If anything, as we know, that they may not actually tell the whole truth about how much pain that they're in. Because when they complain about pain, they're often not believed. Again, because you can't see it. There are many reasons for this, but there's a good myth out there that pain sufferers exaggerate their pain in order to gain sympathy or avoid responsibilities. Especially in children, the research indicates that they I don't want to say do not malinger. They might in some very small cases, but generally speaking, the research indicates that they don't. Adults, look, there is a chance, but more often than not, many don't. In general, people don't go around pretending that they're in pain to get sympathy. Research has shown that exaggerating or malingering are actually really quite rare. Remember that pain is whatever the experiencing person says it is, and it's wherever the experiencing person says it is, or what it does. Now, this could be difficult because you may not have insight and you may just blurt out things, but try to avoid things that may hurt. Just throw away comments like, oh, you'll be fine, or you just have to learn to live with it, and you don't look sick, you don't look in pain. And these may come from a good place. They may come from a good place. Perhaps you're just angry and frustrated, and you know what? Fair enough. However, these throwaway comments are really kind of very, very hurtful for people who are in pain. Having compassion. So put aside your cares and your preoccupations just for a few minutes and listen with an open mind and an open heart. And I think that really makes a difference when you are listening to someone. Also, be honest about the limitations of your own knowledge about their condition, their mental and their physical condition. So you're not a counselor or a psychologist, you're not a doctor. So say I'm here to listen to you, but when if they ask for advice or things like that, be honest and be truthful. Look, I don't know the answers to that, or that's not my expertise, or whatever it may be, but it's better to say that than to pretend and get yourself or them in trouble. Okay, lastly, look, we're all human, so no one is perfect. Expect to get it wrong sometimes when you're looking after somebody who's in pain. One day it might work, something that you say I'll do, and the other day it won't. Be prepared for things not to go the way that you think that they would. Not every day is going to be rainbows, lollipops, and sunshine. Some days are going to be hard. It sucks. Nobody wants that. But it's okay. Things, experiences, emotions, they will pass. Things will change. But expect them to go up and down. And don't feel guilty for taking time for yourself. So it's really important that you look after you. If you're not looking after you, how are you to look after the person who is in pain? And also your loved one who is in pain, they may also like time for themselves without you. And the same thing if they're in an irritable mood and they say something hurtful, try not to take it personally. It's easy to say, hard to do. Lastly, here are references. You can come back and pause the slide if you'd like to look at this further. feedback and questions of today's session, please send them my way. I really love to hear what you have to say, or if you'd like me to talk about something, you can email me or call us and ask to talk to me. I hope today's session you learned something, or it confirmed something, or it validated something for you. If you're looking after a loved one in pain and it's not easy, you're doing a great job, and keep it up. But take some time out for yourself. Catch you next time and take care.